My name is Alexandra Ramos, and I have been asked to review the independent living community for Georgia. In the recent weeks, staff members have noticed that Georgia has been missing often and has at least once left her front door open. Her physical health is good, and she takes medication for blood pressure and moderate arthritis. Her family lives approximately an hour away, and Georgia usually has visitors during the weekend. During the last visit, Georgia called her grandson Jack by his father's name, David. While an individual behavior, even in isolation, might not mean anything with the current historical accounts, it is necessary for Georgia to be tested for either a physical illness or even Alzheimer's or dementia. Unfortunately, Alzheimer's is often the go-to diagnosis when an individual starts to show any signs or symptoms that might indicate forgetfulness or a problem with recent memory. Before moving on, a historical record of Georgia needs to be completed to see if any other family members have had problems with either memory, Alzheimer's, or any other age-related illnesses that might cause forgetfulness. Currently, Georgia is not a high-risk state, although disappearing from her room apartment is definitely disturbing. I recommend several options. The first is a family discussion with Georgia's children to find if there is a family history that might be causing any type of forgetfulness. During the time of the investigation, I recommend that Georgia not be left unsupervised, especially during the day, as that appears to be the time that Georgia most often goes missing. The behavior might be a result of the fact that Georgia has found a new friend that doesn't live at the facility. An interview with Georgia will also be done, but it needs to be done without causing her to be upset. The most important thing is to determine if Georgia is missing due to her choice or an age-related issue. If any of the historical medical records report negative for dementia or Alzheimer's, then I recommend a full medical evaluation on Georgia to determine if indeed her recent behavior is due to an underlying condition. A full battery test should include time with a counselor, an MRI, an interview with the medical doctor. Sometimes there are treatments that can slow down early onset dementia, and if this is the case, it is imperative that we do not wait. While pharmaceuticals have not shown to be a great effect, counseling and therapy have proven to be beneficial. Furthermore, the family will need to be fully informed so that they can begin to understand the reasons for the investigations. Dementia has been described as a long death, with the patient losing all ability at self-care, and the family will need to know if they have to what they have to look forward to. The entire family is possibly going to need support both emotionally and possibly financially. Looking at the positive side, Georgia could have a simple medical issue that can be found with a battery of tests by a medical personnel. Finding out an answer sooner rather than later will be beneficial to everyone, especially Georgia.